What is the best thing to do to stop getting headaches? I'm not talking about taking Tylenol or Excedrin. It's to prevent them and stop getting them. Hello, everyone. This is Dr. Mitch Freeman. I'm a board-certified family physician. I've been a physician for 34 years. I'm here to spill out all my medical knowledge and experience for everyone for free. So we know that most people, the way they treat headache is they go take a Tylenol or ibuprofen or Excedrin to treat the headache when they get the headache. When I'm talking about what is the best thing to do to stop getting those headaches, to prevent them from happening in the first place. So, my personal experience as a doctor, when people have chronic headaches, they come to me. The first thing they want to do is MRI and a CAT scan and see what's wrong with me. Do I have a cancer? Do I have brain tumor? Do I have this? 99.9% of the time, it's the treatment. It's very simple, and the way to approach it is not start with the MRI. MRI has no productivity in this, unless there's other warning signs that we're not going to get to this in this video. We're talking about simple headaches that people get like once or twice a week. And first of all, I consider all headaches are migraine headaches, and people think migraine headaches are the severe headaches that you get when, like, very, very bad headache. You have light bothering your eyes. You want to close your eyes and go in a quiet place. That's a migraine headache. But you can have a mild migraine. Like, I get migraine myself. I'll explain my experience with it. So you can get a mild migraine that your headache just like a little bit of pain, like 2 or 3 out of 10. You feel like moving your head hurts, and you don't want to look into the light. You want to kind of be quiet in a quiet place, no noise. That's still a migraine. Or it could be more severe, or it could be very severe that you cannot tolerate anything. A lot of people want to go in a quiet room and sleep it off. That's still a migraine. So a migraine is not only the severe headache. You can have a mild headache, a moderate migraine headache, or severe migraine headaches. And migraine headaches is caused by the brain itself gets sensitive, and whatever inside your head gets sensitive. They're moving your head, and in any direction it hurts. So I'm going to tell you today how to prevent getting them, to prevent it from happening in the first place. I have not referred headache patients to a neurologist in more than 15 years. I've been practicing in Yuma for 25 years now. The best thing that works for headache is very simple. People don't believe it, but it's very simple. Is manage your allergies. So allergies, what are you talking about? You know, some people don't even have allergies symptoms that they're aware of. I'll tell you this. I remember this case. I have a 32-year-old female came with complaint of recurrent headaches. She was a paramedic, and she said, "I'm having this headache." She was describing this headache. I want to do something for it. So at the time, we used to get samples of nasal spray. I gave her this, I remember at the time it was a Nasonex, but they all would work. This is a fluticasone. I gave her a Nasonex nasal spray sample, told her, use this twice a day, and come back in 2 weeks. She did. When she came back, she said, "I'll tell you the truth. When you gave me this nasal spray and told me to use it twice a day, I thought, what is he smoking? I'm having a headache. I don't have allergies. Why is he treating allergies and I'm having headaches? But I believe you and trust you, and I did the nasal spray because I believe in you." So she did, thankfully, she did the nasal spray twice a day. She came back, she said, "I don't have headaches anymore." Now, this patient, when I asked her, "Do you have any allergy symptoms? Do you have stuffy nose, congestion, sneezing?" She said no. So in reality, we all have a degree of allergies. Some have, we're talking about sinus allergies. Some have it mild, and some have it moderate, and some have it severe. I mean, the people that have it moderate or severe, they know they have allergies. And those people, if they get headaches, they really need to control their allergies. Otherwise, the headaches will not get better until you control the allergies. So this patient have no allergy symptoms that she can recognize, but I can tell when I look in her mucous membrane, I can see the mucous membrane color. It looked like she has allergies. As a doctor, I recognize these things, and I look in people's noses and ears and and mouth, and I can tell things that average people cannot tell. So if you have recurrent chronic headaches, mild or moderate or severe, please use allergy treatment. And I'll tell you the most effective thing, two things, and they're both over the counter. You don't have to go to a doctor. The first thing you need to do is to treat your allergies. We're talking about treating headaches. Yes, allergies is a big trigger for migraine headaches. Even if you don't think you have allergies, even if you think, I don't have any stuffy nose, I don't have any congestion. Oh yeah, occasionally I sneeze. Oh yeah, I wake up in the morning and I sneeze, or I blow my nose, or I get a little bit stuffy, but I thought that's normal. Most people, because they have it all their life, they think that's just how everyone is. Believe it, they think that's everyone have that congestion. It's not true. People don't naturally normally have sinus congestion, but people have allergies because they have it all their life, and everyone in their family have it. They think it's normal. So the main effective thing that I do is these two things: steroid nasal spray and a sinus rinse, both over the counter. You don't have to go to the doctor to get it. You don't have to come to me and get it. You can do it on your own. This, it's over the counter. They come in different brands. This is called fluticasone. They come in another brand is called Nasonex. They sell them for $10 to $12. The best deal at Sam's Club and Costco for this one, 6 of them for $25. That's like $5 a piece, and each one will last you a month. This is a Neilmed sinus rinse. By the way, both of them, the picture of them, I put them in the thumbnail picture of the video. Neilmed sinus rinse. The manufacturer tell you to replace it every 6 months. I have this for 3-4 years now. So what I do is I use this whenever I don't have bad allergies, but whenever I get into any dust or do any cleaning, garage cleaning, backyard cleaning, blowing dust, I would use a nasal spray. But people with allergies and you have headaches, you need to use this every single day. Whether you have symptoms or not, you do it every day. So what I do is, to keep it clean, is after I use it, I store it this way, separate this way. If you keep it this way, condensation and water will sit and it could mold. But if you keep it this way, I have this for years. I have not replaced it, and it's fine. So to treat the allergies, these are the most effective things. 90% of people, that's enough for them. So the idea is, you use this Neilmed sinus rinse, is you fill the water, warm water, to this line, as warm as you can tolerate, because the warmer the water, the better in cleaning mucus. Cold water doesn't melt the mucus as good, but I would go as warm as you can tolerate until the line, and then you put a packet. This has salt and baking soda. It's not a medicine, because water in the nose will burn the inside of the nose. This will make it not burn. So you always have to mix it. Do not do it just with water. It will burn your sinuses. It will really hurt. It will give you a headache. So warm water, packet of salt, cover it, shake it a little bit. I put a link in the description of a video of a person showing you how to do it. And then you lean forward, lock it up your nostril, and I would squeeze gently. Don't do it hard, gently. Squeeze gently. The water will come from the other side. That's saline. Will come from the other side. And then I would blow it gently, and then do this side. Same thing. I would gently do that, and the water will come from the other side. And then gently do that. Now, if you are congested and you're trying to do this and you feel it's not going in or it's backing up into your head, stop. Don't do it. Don't push it hard, because you can push it to the ear, middle ear, and give you an ear infection. Go the other side. If you can push it through the other side, then just do this side, and until this bottle is empty. This is you're making a saline and you're rinsing your sinuses. So what this actually is doing is, what we're allergic to, things in the air, pollen, dust, things in the air. So if you have allergy to something gets on your skin, you don't just put medicine on it. First, you have to wash it off, and then you put the medicine on it. So what you do with this is you're washing out the pollen, the dust, whatever in your sinuses, because your sinuses are a filter, air filter for your head. And this air filter in your head, if it catches some stuff, it will react to it and cause swelling, inflammation, irritating your nerves irritating your olfactory nerve in your sinuses and triggering headaches. So first thing is you do this every single day. The best time to do it is in the shower before you wash your head. Again, in the shower, before you do anything, you do this. And the reason is it's normal when you do this, some fluid will sit in the sinuses. And then when you wash your hair and you're doing this, some fluid will drip down. When you're doing this, some fluid will drip down. This, some fluid will drip down. So the sinuses, the opening for the sinuses, they're not big opening. They're small opening and situated in certain spots in your inside the nasal cavity. So each sinus, like some sinuses will drip, will drain if you do this direction. Some will drain this way. Some will drain that way. Some will drain that. So each sinus will drain in different direction. I'll do another video about allergies and treating allergies and talk about sinuses. So that is to clean the pollen and dust and whatever you're allergic to from your sinuses. And then once you do this, you give it about 30 minutes or so, then you do the nasal spray. This is a fluticasone nasal spray. It's the most commonly used. It's over the counter. They do come in a prescription and they come in over the counter. So when you get a brand new, like this one, first you prime it, we say, a couple spray until you see it spraying, and then it's very, very important to do it right. I've seen so many patients, they have this nasal spray. They have the right medicine, but because they are not doing it right, they don't get better. And if they're not doing right, they don't get better, they don't get the benefits. And I actually searched on YouTube. There's so many videos of telling you how to use a nasal spray. Even the manufacturers, I don't like how they do it. It's wrong. I'll show you my way that works. You hold the nasal spray straight and keep it straight. You bend over, looking down. You put your nasal spray up in the nose. What I like to do, I like to put this finger, stabilize it on my lip. So when I'm doing this, this is stable and I'm not shoving it up the nose. Only the bottom finger is moving. So I do this and close your mind. And you have to do this sniffing. You have to do long and strong sniff. And the timing is once you start sniffing, you hit it like this. Keep your head down. Next side. Keep your head down. You do this one each side, morning and night, every day. The reason I keep my head down, because whenever you spray anything, the gravity brings it down. If you spray it and do this, it will go to your throat. The throat is not the target. And how do you spray in it? It doesn't go up to the ceiling, the spray, it goes down. So if you go do head down, when you spray it, it settles in your sinuses. It doesn't settle in your throat. If you taste it in your throat a lot, that means you're not doing it right. So strong, long sniff. Again. You notice I exhale from my mouth, so I don't exhale the medicine. It's very important to do it this way. Otherwise, you're not going to get better. So you do this twice a day, morning and night. And if you have a flare-up of allergies, you can do it 4 times a day for like a week or 2 and then go back to the usual twice a day. Now remember, you do this whether you have a headache or not, whether you have allergy symptoms or not. You do this every day, morning and night. And you do this in your shower, the sinus rinse every day. And you won't have headaches anymore. Or at least you minimize them. If you get headache every day, maybe you get headache every 6 days or every 2 weeks. I will do another video about migraine headaches and triggers and how you track your triggers. But really, this works in 9 out of 10 for most people that have migraine headaches. Use this over the counter. You don't have to go to the doctor. Do it on your own and you'll be fine. This is for today's video. If you like this content, please like and subscribe so you'll see my future videos. I will see you on the next video.